Hey everyone, welcome. So today's talk is for you if you're just starting out with brain AVMs. Like if you're a complete beginner, this is where you need to be. First of all, AVMs, they're complicated, right? It honestly takes a lot of time and patience to really understand their angioarchitecture and how to treat them safely. And in the beginning, I really urge you to sit down and study all the imaging. Like, take a good hard look at the MRI. Look at any previous angiograms, CT angios, MR angios, anything you can find. Everything helps. Because honestly, the more you see, the more you understand. The key to treating AVMs, the real key, is understanding. If you understand the anatomy, if you know exactly which arteries are feeding the AVM, how many veins are draining it, where it sits in the brain, then you're already halfway there. And the location matters so much. Like, is it near the speech center? Is it next to the brainstem? Or maybe it's hugging the thalamus? Each of these locations comes with its own special challenges because, and this is important, traditional endovascular treatment through the arteries can sometimes hurt the surrounding brain if you're not careful. So, like, if you're treating an AVM near the speech area, you have to talk to the patient and family beforehand. Let them know, hey, after the procedure, there could be some speech problems, at least for a while. Okay? Now, when you're trying to understand an AVM, like really get it, you can't just look at one image alone. You got to correlate everything. And here's how you do it. Open your imaging workstation and first open the coronal MRI next to the AP angiogram. Put them side by side because they're basically showing you the same plane. Yeah. Both of them are showing you a front to back view. Then do the same thing with the sagittal MRI and the lateral angiogram. Again, side by side, because they are both working in the same plane, right to left. And here's the trick. You move through the slides together, like you scroll through the MRI, and at the same time you scroll through the angiogram, walking side by side, frame by frame. You'll start to notice, oh, this vessel I'm seeing on the MRI, it matches this shadow on the angio, or this draining vein in the MRI. It's that same one I'm seeing emptying on the angio. It's like two different languages saying the same thing. And once you walk through them together, you start understanding it fluently. At first, it feels weird, a little confusing maybe, but if you stick with it, I promise, it will click. You'll start seeing the AVM in 3D in your head, naturally. Now, about the draining veins. They're tricky. You don't always spot them right away. Usually, each little part of the AVM, like each lobule of the nidus, drains into small primary veins. And these primary veins then join up to form the bigger draining vein or veins. Sometimes the main draining vein splits into branches. Sometimes it stays as one straight vein, draining either to the superficial venous system or the deep venous system. And here's a tip that helped me early on. Look at the AVM like it's a tree. The nidus, that's the leaves of the tree. The veins, they're the branches in the trunk. So if you're lost, just think, where's the center of the tree? That's usually where you'll find the draining veins starting to exit. It sounds simple, but trust me, it helps. That's a good stopping point. Coming up next, we'll get into a deeper look at the arterial feeders and why some feeders can seriously trick you if you're not paying attention. Stay with me.